Your neck, it can be a real, well, pain in the neck.
That's absolutely right. The neck is less protected than the rest of your spine, which we've got demonstrated here. It's more vulnerable to injury and disorders that produce pain and restrict motion. We welcome our frugal fitness guru, Linda Burry, as well as Patrick Myers of Apex Physical Therapy. We thank you both for coming in today.
Good morning.
Now, as we've discussed, I have this little sort of ruptured disc right about in here, cervical disc.
Right.
So what do I do about that? It sometimes gives me pain down my left arm.
Okay, well, let's do a quick little lesson here, and let's take a look at the spine.
Show me what I look like.
Well, your area is right here between the purple segment here, the last purple segment, and this first green segment.
C6 and C7.
C6 and C7.
All right.
Now, a lot of people have problems in these areas, not just herniated disc, but they may have problems at the joint, problems at the nerve, some type of aggravation. And so what we want to do in physical therapy is get this joint to move again and move nice. See, right now, yours is kind of compressed down, and it's not allowing things to move appropriately.
And you've got some pictures, too,
Right.
Patrick, that'll show us kind of what we're talking about.
Right.
The first shows the pinched nerve, right?
Shows a pinched nerve there, and you can see that segment on top, the big bone on top, is kind of squeezing down and putting some pressure on that nerve. And the reason is because the disc is not in its normal area, and normally it would give enough space so that nerve can operate.
So that's just one of the problems, and then this is called cervical pathoanatomy. What's
Right.
that?
Here, well, pathoanatomy just means anatomy that's not normal.
I see.
In other words, like in this picture, you have arthritis or some type of bony degeneration, and that also causes the bones to sit down on top of one another, therefore not giving the nerve enough room to move.
And that's why my arm sometimes has the
And
reaction.
that's why your arm sometimes, if you look at this picture, you can see up in the neck, you've got the problem, the origin of the problem. But down the arm is where the pain, you actually feel the pain. Now, I've had patients that have no pain in the neck, no pain in the shoulder, but pain in the wrist or hand. And they've been to several doctors who diagnose hand symptoms or arm symptoms, and when we start to look at the neck, it's actually the neck.
All right.
Well, Linda's brought in, she's got a couple things in her hand. One is the more professional tool, the other is the frugal way to do it.
Yes, the frugal way to do it. Look, they're about the same size. You know, it's just a paper towel roll. So why don't I have Patrick to actually demonstrate with a towel, a really interesting way to have Barry immediately relieve some possible pain.
Oh, okay. I love this. We'll get started on this.
And then we'll get to the frugal ones.
All right.
Slip right back here. I'm going to show Barry a way to set a towel right on the edge of his neck. So if we go down here at C6, C7,
which is right around your shirt collar.
which is right around the shirt collar, it's the first big bump in your neck, the next step up, okay?
Okay.
And if you turn just like that a little bit.
All right. Too much.
Right there, too much. Now, Barry has a little problem when he lies on his side, which puts his head like that, and that will kind of cause the pain to go down his arm.
Right.
So what we want to do is use this towel.
I hold on to this.
Hold on to the towel.
Yeah.
Pull up toward your eyes, okay, and now tilt your head off to the side.
And so that takes some of the pressure off that
Right.
that
What
disc.
it does is it lifts that segment. And
I could be
glides-
taller after this, too.
Exactly.
That'd be wonderful.
That's just a bonus.
All right.
We're
Well,
going to continue
this
to
is
do
good.
this.
I'm
And
going to work
Linda's,
on
when
this.
we come back, we're going to have more with Patrick and with Linda, and she's going to show us a couple of other different things to do and things you can do with items that you might find around your home to resolve neck pain. So stay with us. We'll be right back.
I always like to hear when he says buckle up and
I
drive
know.
safely.
We're back with our frugal fitness expert, Linda Burry, and Patrick Myers of Apex Physical Therapy, showing us some ways to alleviate back or neck pain. You're already doing one of them. And Linda, what do you have in your hand?
Well, these are mainly ideas to help you to stabilize the area that Patrick's just shown, Barry, that is troublesome. Well, this is our expert TheraBand that you might find in catalogs that are very difficult for people to get a hold of. So I've also brought in my frugal paper towel tube.
Excellent.
Okay, 45-degree angle. This is called scaption. You're going to straighten your arm out, and I just want you 45 degrees away from your body. I want you just to lift it, raise it, and then lower it down. Range of motion. And this is going to help.
You could also do this with a can of corn or something.
Well, maybe not too heavy.
I see.
Yeah, maybe something pretty light.
An
Paper
empty
towel.
can of corn.
Exactly, an empty can of corn. There you go. Especially for Halloween canned corn.
I'm going to continue doing this while
10 times.
Thank you very much for coming in today, both of you. Appreciate that. See if my neck doesn't feel better. Coming up on Fox in the Morning, there is a mummy in downtown Louisville.
It really is spotted, and Darren Adams is showing you where to go for a peek at the mummy and a polar bear and some other cool stuff when we come back. Hey, watch it. Now I'm going to have a pain in the